I work in child and adolescent psychiatry, which is part of CAMS, and I'm one of the doctors in a team of a range of different disciplines, so clinical psychology, family therapists. Together as a team, we see a range of children, adolescents and their families who get referred, mainly through GPs, but there are other routes in as well. With significant emotional behavioural difficulties. It's an outpatient-based specialty, so there will be outpatient clinics, there will be team meetings, writing reports, liaising with other professionals, multidisciplinary team meetings, and then there's the usual things that doctors do around training and revalidation and research. I like working with young people, with children and with parents. There's various different ways of actually making sense and formulating the difficulties that a child or adolescent or a family are having. So there's kind of systemic approaches, there's individual psychotherapeutic approaches, there's more cognitive behavioural, there's some medical diagnosis involved. So there's lots and lots of different ways of looking at a case to get the best sense of what of what ways you can actually help that child or that family with. And I really like that complexity, and there's nothing more complex than a family. There can be difficulties from other organisations outside of CAMS. So education or social care may have very different frustrations and expectations on your service. I'd recommend child psychiatry as a career because it's consistently challenging, interesting and complex. And the complexity of the situation that a child or an adolescent and a family are in is a challenge to understand and to make sense of in a way that's going to be really helpful for that individual or that family to use. It's unusual having to embrace that whole experience of a family and an individual within it in order to make sense of their difficulties.